Hey guys, the disorder that I chose was bipolar disorder because I have a friend who works at a behavioral health facility and this is the disorder that she works with most commonly. This is my friend from college, Christina Amin. She now lives in Knoxville, Tennessee, where she works as a residential counselor at the Helen Ross McNabb Center for Behavioral Health Care. Christina earned her bachelor's degree in psychology from Emory and Henry College. A residential counselor is part of the social work team that helps to create and implement treatment plans and goals for their patients in order for them to live and work independently. They monitor the progress of their patients and make adjustments in their treatment accordingly, and they mediate between their patients and the patients' families, legal situations, and the community. Most residential counselors have at least a bachelor's degree in a field like behavioral health or psychology, but it is sometimes possible for them to secure a position in a facility with an associate's degree or high school diploma. Most residential counselors also need certification, especially if they distribute medicine to residents. So here's a link to a short video about the Helen Ross McNabb Center if anyone is interested in more details on their facility. At the Helen Ross McNabb Center, Christina works with adolescent girls who are in custody of the DCS who are being treated for behavioral or substance abuse disorders. During the program, she works with about 14 clients at a time, and about 70% of them have bipolar disorder. Many of the girls also have substance abuse disorder, which is a very commonly occurring disorder with bipolar disorder. Her job is to guide them through their daily routine and help them cope with emotions through therapy groups and discussion. The girls participate in group therapy twice a day. The subjects include alcohol and drug counseling and life skill counseling. They also meet with therapists once a week for individualized one-on-one sessions. When they are not in counseling, the clients spend a lot of time working on independent living skills such as cooking, laundry, socialization, watching movies and playing games with each other, and completing chores around the house, as they call their facility. The goal is for the girls to learn how to function independently in society. The main collaboration that Christina has with other healthcare providers is taking the girls to their basic appointments, such as doctors, optometrists, OBGYN, dentists, and other appointments. Christina emphasized that many of the bipolar patients also struggle with drug abuse, resulting in significant oral health problems, and many of them are not very compliant with dental education. Their hygiene depends largely on their home lifestyle before entering the program. At the facility, the counselors mandate hygiene, including their oral hygiene. She even has to test their toothbrushes to see whether or not they are wet. If the girls do not shower or brush their teeth or do other hygiene chores when they are supposed to, it results in the loss of privileges. When I asked Christina what the greatest challenge she faces when treating patients with bipolar disorder is, she said that it is a big struggle getting them to cooperate sometimes, and she never knows what version of the patient she will experience that day. They have such a wide range of emotions that it is hard to anticipate how they will act from day to day, and the emotions can fluctuate throughout the day as well. Some days the girls are very cheery, some days the girls are very depressed, and some days they are extremely angry. She has one girl in her program who can fluctuate from highly cheerful to highly furious, and vice versa within the hour. I asked Christina what I could do when I encounter a patient with bipolar disorder in the dental office. She said that it is very important to be empathetic with the patient. If they begin to get upset, it is most likely because they do not understand what is going on or the information that is being given to them. They may get mad if they experience pain and do not understand the purpose of it. She highly stressed the importance of being patient with them and taking the time to educate them on why the treatment is necessary. If you show signs that you genuinely care about them and want to help them, they will most likely open up to you. She also stressed the importance of patient education because many of them simply do not know why it is important for them to brush and floss their teeth. A general characteristic of her patients with bipolar disorder is that they all respond very well to empathy and care.